Yeah.
Okay. Okay. We're just starting the budgeting process.
Got me, Bill.
It's up to Richard.
Well, Bert's got to run the show.
That better?
My eye doctor says better one, better two.
We good now? Okay, as I submitted my budget, probably the biggest problem that we noticed was the benefits were quite high. When I followed the information that, I was given for the benefits, it put my budget $1.1 million over budget.
Wait,
So-
what? So up in your personnel?
And
That-
yeah, just in the benefits line, 1,300.
We're supposed to be getting those towards actuals this year. That would
So
make it easier
instead
for
of
us to-
2.1, last year it was around $1 million?
This year, when I put those numbers in that I got, I didn't get actual numbers. I
Oh.
got just a sheet that said, this is what the benefits are.
Mm-hmm.
So I plugged those numbers in and I calculated it was 2.3 million for our benefits, which was 33, well, it would have been higher than that. It probably would have been a 40% to 50% increase on the benefits.
What's his 2017, Deneen? He's got to be close to that. How many employees do you have?
About 120.
Okay, so are 20% of them on insurance waivers?
No,
Are 10% of them?
we have about 7 that are on waiver.
Okay, so, there's $10,000. I mean, even if they all left, right? Like,
Oh, the zeros all the way across on your insurance waivers and
Right, in the system.
in the system.
so you only
That
hire,
gets filled in later.
you only hire high-risk single people? I mean, that's, to look at an insurance rate that jumps that much, I mean, that's crazy.
Well, like I said, they just gave me a family rate with the percentage, and so
Yeah.
I put
It's not,
that in,
yeah.
Yeah.
It's not supposed to be the family.
and it was way
So in
too
other
high.
words, you're telling us it didn't let you plug in everything else because your numbers were too high on that?
Well, I went back through client or staff member by staff member and tried to estimate what I thought it would be. Some people, and I just kind of based it off their previous years. Of course, that doesn't adjust for somebody that gets married or anything like
Sure.
that. But I was able to get it down to about 700,000. I was out of budget.
So in other words, your best guess is you really think it's about 1.5-ish.
The benefits,
Yes.
I think the total will probably be about 1.8.
Okay. Good enough.
After all is said and done.
Sure. So based on our sheet, that's about $400,000. Okay.
And just looking at the numbers from HR, because they did go and calculate it based on an actual basis, but it looks like they're using $18,000 for an annual family medical insurance. Does that seem right?
No.
The
It
sheet.
seems high.
Yeah.
Yeah,
The rate's only going up 2%.
yeah.
Yeah.
So
That's what I
told-
wondered, because I was like, I don't have a percentage to go off. of.
2%.
Yeah.
So I just guessed.
So I told Bert when he sent this email to me yesterday that I would follow up with Ralph and see if we can't get that recalculated.
Okay.
Do you by chance have a 2017 budgeted number for their insurance?
There's a budgeted number, but remember that wasn't budgeted at actuals either, so I'm not sure how helpful it will be, but the number was 2017 actual was 1.465 million.
Okay, so
20,
1.8 sounds reasonable as far as where he's probably at then.
Considering
That's
the
what I-
But
2%.
anyway, that one will have to
That's
get fixed.
2% too.
Yeah, and that's what I mean. That'll have to get fixed. That's not your problem. We can go to the others anyway.
Okay. So, do you just want to go through my overage, or do you want to go through our additional request?
It's your meeting.
So I emailed to Deneen and I said, I've got 4 ways that we can solve our overage. One, the county just pays the difference. That's the easy one.
Is that the 600,000 at the bottom?
And you're working off this sheet,
Well,
right?
no, I think it would end up right around 400,000.
You're working off this sheet so I can follow you?
Yeah.
Okay.
The second one is we have vacant positions right now that we could just not hire, and that would make up the 400,000 right there.
Okay, so for anybody else watching budgets, I want you to get a chance to clarify that statement. Whenever I hear we don't need to hire somebody, now your
No.
department's the difference for me because I have complete trust in how Richard and you guys manage, right?
Right.
You tell me something, I really do believe it.
No, what
But
I'm,
when we say we don't hire somebody, it makes it sound like we don't need somebody, so why do we have them, right?
well, what happened is we haven't been able to hire those positions, just
That's
because of-
different than not needing.
Right. And now this is, we've managed to continue our system
Right.
without those positions.
For how long?
But what I'm saying is we'd have to do that for another year. However, we do know that the state, and this is number 3, we do know that the state is going to give us some more money, but we have to apply for that money and we have to do it. We have to fulfill the needs of that money. Now, whether or not we can fill those holes with that money, I don't know. That's an unknown at this point. We will fill
I'm
that.
I'm gonna say some of it we can. What Bert's talking about is the SOR, State Opiate Response Grant. That's the secondary money to it's federal funds, secondary to the STR grant. So those two things are both in play. SOR is new. STR is probably going to be renewed to some extent, but that's what we use to provide medication-assisted treatment. And so we're bumping up our heads against how much medication-assisted treatment we can provide with Dr. Cherniak. There are a couple things that we budgeted to do with that we haven't done yet, and that's hire an additional case manager assigned to her for medication-assisted treatment. So if we don't hire those positions that are vacant to provide treatment services, what that means is we end up providing less treatment services and risk kind of going into a death spiral.
So, Richard, that's my point. Then why would we even suggest or offer to not fill positions that you see necessary to provide the services? That's the cautionary tale I'm trying to tell everybody is when I hear it that way and, oh, well, we'll go without it. Yeah, but at what expense? And I'm glad you said it that way because if we need it, obviously we're trying to avoid that. We're trying to maintain a service level. So why would we even consider that an option?
Well, I think from their question, why we consider that is because if it's gonna be grant funded, then possibly we go that direction.
But only portion of it.
Well, I just want to give you guys options. You know, number one is the county funds it. The county
Well,
funds the
Okay,
difference.
so let's understand. The commission always has options. We can strike the whole flipping staffing plan, right?
Right.
What we want to hear from you, at least, okay, let me rephrase. What I want to hear from you today is, what do you need to continue to do the great service that your department does for the county? If that means the commission needs to come up with $500,000, I want to know why, right?
Right.
If there's things you can do internally to save a few $100,000, or if there's potential other grants, I want to know why. Other than that, see, because like you've already told me, $770,000 over budget. Well, we've identified several $100,000 because the insurance.
Right.
You've already taken that into account.
Right.
Again, you're coming from a position of strength with me. I've always believed and trust everything you guys have been the one department. Anytime there's, hey, we're under by 100,000, Richard's coming to us before it ever comes to us and has a plan, right? So that for me is how I believe this should go. Tell me why you need it, what service it provides us, or why we don't need it.
Okay.
So your $300,000 is what I'm hearing,
Right.
if we get the other
400.
one corrected. And we don't even know where that's at for sure yet.
Right. Until the actual benefit numbers come in, we
Right.
won't know. And so at that point, I'm thinking we're probably going to be about 400,000. That's what we would need.
That's your projection.
Okay?
And what we're asking for is those sheets. One of them is just a position that he's going to get licensed It's Aloe. And so his position will bump up to the next clinical therapist 2 position. Another position that we're asking for is Erica Hickman. That one was mess up. Somewhere along the lines when, right around when workday started, she got a pay deduction and nobody noticed. And we didn't
Not
figure
even
that.
her.
What's that?
Not even her.
Yeah, not even her. So we figured it out as we were going through the budget process, and so HR has fixed that now, but it's not in the report that they sent out to us. So we're asking for that as well.
Okay, so see, to me, that's not really an ask because those things are gonna get taken care of, right? That's
Well,
not an ask.
But it's
I
higher than
appreciate-
what was reported.
So you're about $300,000 in with these? A little over
Yes, if you
300,000?
take-
That's a piece of it.
If you take out Erica, yes, because Erica, again, it sounds like has to be done or is already done. They just didn't give you the right
It's
formula.
already done.
Yeah,
Yeah.
so in other words, you have 4 positions that total about just over $300,000, just barely.
Right,
That's really the only ask. Other than that, you guys can manage everything else you have.
correct.
So if the county, if the commission
The-
agrees to these positions, to fund, potentially there's other grant monies to help you guys do this, but otherwise, you're looking for a full commitment from the commission to have these positions.
The 2 that are UCAP, we're asking for additional funds for that program through
Right.
the county. We also
So
believe.
that's the only thing that's, well, not exactly true. That's the major thing that's a brand new ask, is
Right.
those additional UCAP positions. And that's to match what the sheriff, we believe the sheriff's asking for.
Right, but again, here's my real question to you. I see these 4 positions. I know how well you guys do with this, okay? Potentially, there's some savings while you're transitioning and getting some of these people on. So we know
Right.
there's gonna be a little bit of savings. But you've identified there's some potential grant money that could also offset some of this 300,000, right? So in other words, your real only ask is you want a commitment from the commissioners for 4 positions that total $300,000. But because of how you guys do it, there will still be some savings that you could kick back and or some grant money. So in reality, you may see this as really a $150,000 ask based on your track
After all is
record.
said and done.
Okay.
Well, there's a difference between budget and actual expenditures, but yeah, it may come out that way in terms of actual expenditures at the end of the year.
Right, and that's what I'm saying. With your track record, that's, you know, because
Yeah.
$150,000 is a big difference in 770,000, right?
Right.
And
Right.
again, if that insurance number comes in even lower, then we're already there.
Right.
Okay. So, I know Commissioner Ivy knows because he's heavily involved in your department. Will you explain to me again what these 4 positions do?
Okay, Aloe is a therapist.
Okay.
He is in our outpatient program. He does the IOP, GOP services.
Okay.
Erica Hickman works at Promise.
We don't need
North.
to talk about Erica. That one's done. That one's an HR problem,
Okay. And then the other 2 are UCAP,
which,
and those are the.
Brand
Utah-
new.
Utah County.
I know, what do
alternate
they do?
probation. It's alternate probation.
They're
Okay.
case managers.
Yeah.
Okay.
So they provide case management services for the I don't even know what you call them. Convicts? That's a terrible thing to say. The supervisees in the sheriff's department. So the sheriff's deputies are the ones that do the supervision, meet with them, home visits, all that sort of stuff. And our case managers make sure that they're getting whatever counseling services are needed, help them with employment and school. A lot of these guys are in college, which is really kind of interesting. Transportation, kind of cleaning up messes that have kind of got them there in the first place. And so that's what NICI does for the UCAP program. So there'll be basically 2 additional NICI type employees.
okay, the 4th one that nobody's talked about yet, that's in my folder, is the full-time program secretary, okay?
Oh, right.
So,
Yeah,
my question is,
that's replacing a half-time program
Okay,
secretary.
because I was gonna say,
On benefits.
you've identified therapists and a case manager for this. My question was who was supervising, but again, he's replacing a halftime.
Yeah,
That makes
Yeah,
sense
this-
on
sorry, I
why a
forgot about that.
supervisor's only 58,000 then, because it's an
This
additional
is-
half.
This is grant due use treatment.
Okay. You're right.
So HR seen these and went through the numbers, and they're,
I just submitted them yesterday, so I don't know if they've seen it or not.
So we need to have HR redo an eval on
HR needs
Erica's
to.
and put your real
Will you,
numbers
will you
in.
make sure and have HR go through these numbers?
Sure.
Redo your insurance, recalculate after Erica's. That way we know the real ask on these four.
Okay. We also found out,
You may want to have them give you new benefit numbers on those four too, just in case.
I found out yesterday we'd like to redo part of our outpatient facility, and that's gonna cost about 22,000 to do that.
Hey, no playgrounds, Richard.
No,
It's just walls.
no, no.
I'm just teasing.
Don't even start.
I'm just teasing.
All right, that's all I got.
All right, thank you.
Thank you again for all you guys do.
Hey, I'm gonna need $11.50 because we got a parking ticket in Guernica today.
Parking tickets are your own responsibility.
First off, I think we need to have a disciplinary council for your illegal activities of breaking the law.
Well, I plead innocence or ignorance. Ignorance would be better.
The judge decide.
Yeah, we just had Judge Collimore in here. We'll get him back.
And typically you haven't had any, so it's grown.
Right, so, and that's another solution. We could dip into that to pay for part of this too.
Yeah, we usually try to hold on to that in case there's the capital building project like Foothill Junior that we keep talking about and keep kind of holding off on because we don't know what's going to happen with the Medicaid expansion yet. I mean, we keep getting mixed messages about whether we'll have the revenue to do that or not.
It's never
but you're
expanding, don't
absolutely
worry.
right. Sorry, Greg, what did you say?
I said it'll never expand in our legislature, so don't worry.
Well, that's true, but the voters are going to pass it in November, I think.
What was in there?
1.4.
1.4.
So it sounds like you could actually fund these asks all by yourself.
We could.
Well, right, we already are planning to use 220,000 of that.
So I guess, Richard, my question is on facilities, right? So having done this with you at the beginning of our term, mine and Bill's term in the relocation or addition of South County, I don't think we held you accountable and we funded and added additional monies, right? I could be wrong, but I don't think we took that out of that because anytime we're expanding facilities and services, the commission realizes the importance of it and has funded that out of our capital expense account. So I guess why do you feel the need to hang on to that all?
Well, there's two reasons for that. One is our Medicaid reserve obligation, and Bert can explain that to you better than I
Sure,
can.
that part I know.
Then the other is, in the past, we've kind of, I mean, prior to your guys' time, we've been held responsible to come up with a contribution toward the construction of the building, and that kind of typically reduces how much we have to pay against capitalization later on.
I would say Foothill Junior, based on the account balance of capital expense, probably ought to be talked about yesterday
Yeah.
rather than in the future.
Well, yeah, that's kind of an interesting.
After you pay that parking ticket, we'll talk about it.
Yeah, we had no idea what this thing said. Sue has a little Spanish to English translator that Google Translate that works off of her cell phone, and all you do is open that app and point your camera at it, and it translates it from Spanish to English on your phone, so you can read it like it was written in English rather than Spanish. That was pretty crazy.
Wow.
And what has to do what with the budget and an $11 parking ticket?
Well, I need a pay raise.
Oh,
Speaking of, you guys are supposed to be doing my performance appraisal.
yeah, I've seen what Commissioner Ivy wrote on that. You might want to stay out of town.
Don't only because I insulted horses the last couple of months. But.
Well, I don't have any more questions for Richard. Again, thanks, Richard, for all you guys do.
Hey, I just wanted to let you know this weird thing came up today. Greg Hughes asked UBEC, this is potential additional revenue and expense, but they're wondering if the health departments or the local substance use authorities should become the cannabis distributors or vendors for the state. I told them, hell no. But you might want to think about that.
I'm glad I won't be in office.
I'm hearing all the ads
We
on
could
the
certainly
radio,
make a few extra
getting
bucks,
now
but
into,
that's
what do they call it?
That would make sure we never have to
Something
raise
high.
taxes.
Oh,
Yeah, they're already advertising.
Utah
Now's-
County High?
Now's your time to invest into their,
that was the most absurd thing I've heard,
You heard
and I
those?
can't tell you when.
it's like, wow.
Wow.
Yep.
Everybody's
Yeah.
got an idea.
All right, well, I
Okay.
figured that'd make your afternoon, so I felt obliged to share.
Yeah, thank you.
Perfect. Thank you.
Okay, thanks.
Yep.
All right, Bert, I'll talk to you later.
So tell the assessors we're ready for them.